Hello, everyone. We'll give everybody a moment to log in and get settled. All right. Welcome, everyone. Today, we're going to be talking about launching your career in medical billing and coding. I will be muting everyone just so there's no interruptions. We're going to be covering a lot of information today about your career development and pathway into getting into medical billing and coding. Since we're going to be covering a lot of information, we won't have time available at the end for Q&A, but I will note that we will have upcoming webinars in the foreseeable future regards to specific topics on career development, kind of career services, resumes, LinkedIn, um, job placement, job search strategies, those types of things. So more to come. This webinar will be recorded and will be placed in the Think of It course for your viewing. If you aren't able to stay the full length of today. But to get started, my name is Jessica Angelescu, Internship and Partnership Procurement Manager. All right, so we're going to be talking about your roadmap into entering and succeeding in the revenue cycle profession through strategic credentialing, skill building, and tactical placement strategies. All right, so what's the reality of billing and coding hiring? So Um, it's not aspirational, it's very operational. Employers don't hire because they dream of expanding their team. They hire because of the critical revenue cycle failures that create financial pain and compliance exposure. So, being able to understand this operational reality influences how you present yourself in the job market. So when we're looking at revenue leakage drivers, those are denials are rising faster than staff can appeal. Clean claim rate has fallen below operational thresholds. Charge capture is inconsistent across providers, and accounts receivable is aging beyond acceptable benchmarks. When we look at some of those operational failures, those are payer follow-up is failing due to volume overload. Compliance risk is increasing from coding errors. Providers are frustrated by constant rework requests, and patients are disputing balances and delaying payment. So the hiring decision is driven by one question. So the hiring manager, the employer, the recruiter, they're asking themselves, will this person increase clean claim volume, reduce denials, and protect compliance without needing constant correction? So to be able to secure a position, you need to demonstrate strong accuracy, attention to detail, documentation discipline, workflow reliability, payer logic awareness, and adherence to compliance standards. So AMBCI is beneficial for employers because it develops dual competency, specialty awareness beyond isolated code memorization. This comprehensive foundation enables you to articulate your expertise in both coding, accuracy, billing workflow, addressing the full range of revenue cycle challenges faced by hiring managers. All right, so what do medical billers and coders actually do? So, being able to understand this distinct yet interconnected responsibilities of coders and billers is essential for being able to succeed in the job market and prepare for certification, and the pathway. So a coder converts clinical documentation into standard codes that drive reimbursement and reporting. It's not data entry. It does require clinical judgment, guideline interpretation, and compliance awareness. So some of the code sets that are core to being a coder are ICD-10-CM, CPT, HCPCS Level II, and modifiers. When we're looking at, job descriptions, employer needs, creating your resume, your LinkedIn profile, putting yourself out there, critical competencies really do matter. So you want to make sure that this is showing up across the board in all your profiles. So you've got the EM logic for office-based and hospital services, compliance and medical necessity alignment, documentation gap identification, and audit defensibility and rationale documentation. Coders protect revenue and audit defensibility. When coding is accurate, claims process cleanly, and when coding is inaccurate or unsupported, denials cascade and compliance risk multiplies. That's why these competencies are so critical in the coding aspect. So a biller coded services into paid revenue. So billers manage the entire claim lifecycle from patient intake through payment posting, navigating payer rules, and resolving obstacles that block cash flow. So when we're looking at it from a workflow domains, you've got eligibility verification and benefits, claim creation and submission, claim status follow-up, denials management. Some of the advanced responsibilities, for a biller is appeals writing with payer policy citations, payment, let me just admit somebody real quick. Payment posting, interpretation, and variance analysis, patient billing workflows, and balance resolution, coordination of benefits for multiple payers. So billers protect the cash flow and the AR performance. Even perfectly coded claims fail if eligibility wasn't verified, modifiers are missing, or denials aren't appealed within the timely filing limits. So why does this dual competency matter? So most employers prefer candidates, who understand both sides of billing errors and coding errors. A coder who doesn't understand claim benefits will select coders that trigger automatic denials. A biller who doesn't understand coding guidelines can identify whether a denial stems from a coding error or a payer policy misapplication. So with AMBCI's integrated curriculum, it builds this dual awareness from day one. Okay, so when looking at entry level roles, this is the focus that you should have. You should not limit yourself to the word coder or biller. Entry hiring is often hidden under revenue cycle titles that don't explicitly mention billing or coding, but require the same foundational skills. So expanding your search terms dramatically increases your application volume and your placement speed. So what do the job titles look like? So here are some, excuse me, some example of entry level coder aligned roles. So coding trainee, coding associate, junior coder, medical records specialist with a coding focus, charge entry specialist, charge capture associate, encounter specialist, claims edit associate, and coding denials analyst, trainee level. When we're looking at the entry level billing aligned roles, we're looking at billing specialist, patient accounts representative, claims specialist, claims follow-up representative, denials representative, payment poster, remittance specialist, eligibility verification specialist, prior authorization coordinator, patient financial services representative. So there's a lot there. But like I mentioned before, we'll be doing kind of a deeper dive in the upcoming webinars to kind of go through these. But do remember that, it's not just a billing and coding job title that you're out there looking for, you can apply to. So the best bridge roles that frequently promote into coding. So some roles may not require a coding certification initially, but they teach revenue cycle logic and create internal promotion pathways into coder and biller positions. Um, Many successful coders get started in these positions and transition within 12 months. So what that looks like. So patient access. So front end registration, teaches insurance verification, demographic accuracy, and how errors at intake cascade into denials. We've got prior authorization teams. So coordinators learn medical necessity criteria, payer policy interpretation, clinical documentation requirements. We've got HIM scanning and indexing. So these types of roles expose you to clinical documentation, structure, chart organization. Scheduling with insurance verification. So responsibilities, build payer rule awareness and eligibility logic. Claim edits and scrubbing support. So those teach claim structure, common error paths, and how clearinghouse edits prevent submission failures. And then lastly, front desk and high volume specialties. So urgent care, dermatology, orthopedics. These teach specifically those workflows and high volume operational disciplines. So when we're looking at kind of a tip or a trick for the fastest placement strategy, apply daily to payer follow-up denial queues, prior authorization teams, eligibility verification roles, because these positions do teach payer logic quickly, have a high turnover, meaning there are lots of job openings, and frequently convert into higher paying coding or billing roles once you demonstrate that you do have that proficiency and accuracy. All right, so multi-skill hack that gets hired the fastest. So the strongest AMBCI graduates do not present as I can code. They present themselves as I can produce clean claims and defending coding choices. So this really does position you in your presentation from other candidates who just sat there, memorized code, to setting you up as an operational asset capable of reducing denials and protecting compliance. So the minimum hireable skill track. So if we're looking at baseline that, gets you the interview, you want to ensure that you have these competencies on your resume because they can be filtered out by the ATS applicant tracking system, hiring managers, recruiters. So that's the ID ICD-10 CM, CPT fundamentals, HCPCS level basics, modifier basics, insurance types, payer rules, claim life cycle and denial categories, HIPAA privacy and discipline. So these are some of those kind of skills, competencies that you want to put on your resume, on LinkedIn, on your applications, that will assist in, the recruiters, hiring managers, employers, looking at, your education, your experience and saying, okay, I want to interview this person. But when we take it a step further and we looked at high impact add-ons that do improve interview rates, these types of skills differentiate you from other candidates in the entry level realm. But they also signal, that operational readiness rather than just having that classroom knowledge. So Excel basics, denial taxonomy, appeal writing, EOB, and ERA rating confidence, and basic audit mindset. So let's go on to looking at differentiator stack that accelerates promotions. So when we're looking at the advanced layer of these positions, in rapid promotion leading into lead audit specialty coding roles, candidates who stick out the most have specialty coding familiarity, chart review, documentation, gap spotting, quality control, sampling approach, productive planning. Um, and this can allow you to advance or be promoted or even skip intermediate kind of career steps, when we're looking at the bigger picture. So one thing I do want to note is that AMBCI's breadth across specialties and integration of both coding and billing workflows directly prepares you for these layered skills. You're not learning isolated code memorization. You're developing the operational competencies employers seek. All right, so CPC versus CPB. How to choose your first credential. So the AAPC describes CPC as a core credential for professional coding in physician service settings. The AAPC positions CPB as a billing credential focused on professional claims process success. The question isn't whether which credential is better. The question is which pathway matches your career path and the immediate placement goals, as long as your long-term career trajectory. So let's look at the CPC. So primary focus is code selection accuracy, guideline application, documentation review, and compliance-focused coding practices across physician-based services. So this type of position is best for candidates targeting coding specialist roles, those that prefer clinical documentation review over financial workflows, applicants interested in specialty coding progression, and then individuals planning audit or compliance career paths. So um, being in the hiring market for the CPC opens doors to coding departments in hospitals, large physician groups, specialty practices, healthcare systems that do have dedicated coding teams. Employers are hiring for coder roles, typically prefer or require that CPC. So taking a look at the CPB, the focus is claims lifecycle management, payer rules, denial resolution, payment processing, eligibility verification, and revenue cycle workflow optimization. So what this position is best for is candidates targeting billing or revenue cycles, those who prefer operational workflows, problem solving over clinical review, those seeking faster entry into high volume hiring, and then individuals interested in denials management or RCM vendor positions. So with the hiring market with this one, the CPB opens doors to billing departments, RCM outsourcing vendors, payer operations, clearinghouse support roles, and patient financial services. So employers hiring for a billing specialist or claim specialist values the CPB. So if you're looking into getting into coding roles the fastest, you want to start with the CPC. Coding positions typically require certification up front, and it's the recognized standard for physician-based coding roles. If you want to get into revenue cycle roles faster, start with the CPB. These roles often hire on workflow competency, promote internally, making it a faster path for entryway. If you want to have the highest placement probability overall, do the CPB first for immediate billing roles, then add the CPC for coder progression. This dual credential strategy maximizes your hireability across the entire revenue cycle. So here with the AMBCI, it's designed to support either role because it covers billing and coding workflows as an integrated curriculum. You're not forced to choose one domain. You're building fluency in both, which allows you to adjust your certification approach based on real-time job market conditions in your area. All right. So, how to sit for the CPC exam. So, the official CPC exam and day guidance provides the authoritative source for all exam requirements, structures, and policies. So, this is just an outline, high level outline based on practical execution and guidance. So, you want to confirm your eligibility, choose your exam format. Um, if you want to test well at home, you can meet system requirements. You can use online proctoring, but if you can prefer a controlled environment, you can use a testing environment or a testing center. You'll need to then purchase your exam attempt. One note is do consider purchasing two attempts, bundle if you can, if it's available. Many candidates don't pass on the first attempt, and this does save money if you can bundle it instead of buying separately. You want to schedule your exam. You want to aim to schedule about 4 to 6 weeks in advance to ensure availability. You're not going to be able to log into the platform, schedule your exam for tomorrow. So just keep that in mind. And then you want to prepare your permitted materials. So most candidates do perform better when they tab their code books in a compliant way. Just builds a quick reference for quick access for modifiers, global periods, EM guidelines, coding conventions, and practice time runs with the exact book setup that you'll use on exam day. Excuse me. So a tabbing strategy here is to use color-coded tabs for high frequency sections like EM surgery, integumentary, cardiovascular, but you don't want to overdo it. Too many tabs will slow you down. And then being able to understand the exam structure. So this exam references 100 questions on taking the CPC and CPB exams. You want to refer to the AAPC guidance for format, time limits, and questions. But the typical structure includes medical terminology, anatomy, coding guidelines, ICD-10, CM, CPT, HCPCS, modifiers, compliant, and multi-code case scenarios. So make sure you're focusing. But one thing that we have seen that has worked the best is developing an execution strategy. Excuse me. Since the CPC exam is time constrained, you definitely have to be systematic. So the first pass, when you're in the exam and you're taking it, answer the easiest questions to secure points quickly without second guessing. Then you want to do a second pass that addresses medium difficulty questions using tabs and reference materials strategically. And then a final pass. So then you want to tackle the hardest questions by eliminating options, confirming guidelines, and making educated guesses. Avoid getting stuck. You don't want to spend longer than 2 minutes on one question in the first pass. Just flag it and move forward. So time management is as critical as coding knowledge. So practice full length time exams under realistic conditions. All right, so what happens after you pass the CPC? So the AAPC explains that after passing the CPC or COC, you may receive apprentice status, which is CPC-A, until experience requirements are met. So this designation is not a failure. It's a classification that acknowledges that you've demonstrated coding competency through the exam. You just haven't yet accumulated that practical experience that the AAPC considers equivalent to a fully credentialed coder. So a key point, again, is the CPC-A is not a failure. It's a classification that employers do understand, and many entry-level positions explicitly will state that the CPC or CPC-A is accepted, because hiring managers do recognize that The apprentice status coders who demonstrate accuracy and workflow discipline quickly become fully credentialed assets. So, how do you get the dash A or the apprentice removed? So, the AAPC outlines pathways and provides an apprentice removal application process. So, this organization also specifies Practicode completion rules as an accepted method under certain conditions and explains documentation requirements for experience-based removal. So, you can accumulate qualifying work experience in a job. And this does require documentation of employment, supervisor verification, and proof of coding responsibilities. The AAPC does have the exact requirements detailed on the removal page. Another way is a Practicode pathway. So if you complete the Practicode program to the minimal thresholds, this pathway allows you to remove the apprenticeship status or the dash A without waiting for employment-based experience, which is valuable when you're job searching with the CPC-A status. And then the third, some formal education programs do have arrangements with the AAPC that provides alternative ways to remove that dash A apprenticeship from your certification. You want to verify your program status directly with the AAPC if you've completed a recognized coding program. So how would you position yourself during the apprenticeship status when applying for jobs? So present yourself as a credentialed coder with proven exam competency who is actively gaining practical experience. Employers, hiring managers, hiring for entry-level coding roles understand the career path and the steps that need to be taken. So your interview language should be, I hold a CPC with apprentice status and I'm completing Practicode to apply my coding knowledge and remove the apprenticeship or the apprentice designation. So what this does is it demonstrates to the employer, the hiring manager, the recruiter that you're proactively addressing the experience requirement rather than waiting passively. So let's talk a little bit about Practicode, what it is, why it matters, and the exact completion target. So it's an AAPC program designed to simulate real-world coding cases and build applied competency. Not just a study tool, it's a credible performance record that you can present to employers as evidence of applied case volume and accuracy discipline. So what does it provide? So real case scenarios, immediate feedback, performance tracking, and apprentice removal pathway. So if we're looking at why is it crucial for placement, it does have three critical assets. So applied case volume. You can truthfully state that you've coded hundreds of real world scenarios. Creates a performance profile that is documented accuracy scores with that show improve that consistency. And it also serves as a credible interview story. So, if they're asking about what you did, you can say, I have coded 600 cases with scoring evidence. This neutralizes the no experience factor without exaggerating. So the official completion threshold. So the apprenticeship removal requirement page states specifically that the completion threshold is a minimum of 600 cases and an overall score of 70% or higher. They do explain how documentation is recognized or submitted depending on enrollment source. So verify your specific requirements on the AAPC apprentice removal page. When we're looking at performance targeting strategy, you don't want to specifically aim exactly for that 75%. You want to kind of target that a little bit higher at 75 to 80, just to build the margin um, and be on the safer side, as well as being able to demonstrate that competency. So employers reviewing your Practicode profile will see the difference between barely passed and consistently performed above threshold. So how can you use the Practicode for job interviews? So you could say, I completed 600 Practicode cases and maintained above a 75% performance score across multi-specialty scenarios. I can share the performance profile that documents case volume, accuracy trends, and specialty distribution. So what this does is it changes the language from I don't have experience into I have documented applied case volume with measurable accuracy performance. And hiring managers really do evaluate this claim differently than I studied coding statements because it's verifiable, quantified, and directly relevant to job performance. Okay, so now that we've covered the CPC, let's talk about the CPB. So the official CPB exam guidance provides the authoritative source for all exam requirements. So let's take a look. So first is confirm your pathway and readiness. Um, Look at eligibility verification, claims submission workflows, remittance interpretation, and appeal fundamentals, ensuring that you have a good understanding of the claim lifecycle, payer rules, denial categories, revenue cycle operations. Then you want the next step is to choose your exam format. So the AAPC help content note exam options. They do have online live remote proctoring or testing centers. Um, so kind of choose what, works best for you. And then looking at the exam structure. So you can definitely, and I encourage you to refer to the AAPC for the CPB exam format and time allowed. Um, Typically, the content for this exam includes insurance denials, claim forms, eligibility and benefits, payment posting, denials and appeals, compliance, patient billing, and coordination of benefits. So once you've got all that settled, you want to purchase your exam and schedule it. Again, you're not going to be able to log in and schedule for tomorrow. Schedule 4 to 6 weeks out to be able to get the date that you want. But it also allows you that 4 to 6 weeks to study and prep. So I know we talked about the CPC study strategy, but let's talk about that with the CPB. So billers fail the CPB when they memorize insurance facts but cannot apply the workflow logic. So your approach should focus on operational scenarios. So intake, registration correctness, eligibility and benefits, claim creation rules, coordination of benefits logic, EOB interpretation, denial categories, appeals and documentation, and compliance issues. Practice scenario-based questions that require you to identify the correct workflow step or decision point rather than just recalling definitions. Individuals that are studying for their CPB should spend significant study time on denial resolution workflows, payer-specific rules, because these domains do distinguish candidates who have memorized concepts from candidates who can actually operate in a billing department. All right, so let's look at how to position your AMBCI experience when applying for jobs. So how you describe your training really does determine whether hiring managers perceive you as a risky entry-level hire or a candidate who is really prepared, who will onboard faster and require less correction. So things you don't want to say, I took a course. This language signals passive consumption rather than active competency building, no measurable outcomes or performance verification, very unclear scope, could be a weekend webinar or a multi-month program, as well as high onboarding risk for the employer. So what you want to say instead is, I completed a structured training aligned to CPC and CPB competency frameworks, including specialty coding, exposure, and full revenue cycle workflow understanding with practice cases and exam preparation. So with this language, it signals the certification aligned prep with recognized industry standards, dual competency, applied practice rather than passive study, and reduces onboarding risk because you really do understand how you understand the workflow context. Language templates for different application contexts. So when we're looking at creating that professional summary for your resume, this would be a great example of, what to put in that portion. So completed comprehensive medical billing and coding training aligned to AAPC, CPC, and CPB competency frameworks. Trained in ICD-10-CM, CPT, HCPCS Level II modifiers, claim life cycle management, denial resolution workflows, and compliance-focused documentation practices. Applied case-based practice across multiple specialties with documented accuracy performance. When we're looking at, building out our LinkedIn profile and, getting the visibility of who you are, what you're looking for, what your experience education is, we look to LinkedIn. It's become, one of those platforms that employers do review and kind of look over when, they're reviewing applications and considering candidates for interviews. So something like medical billing and coding, CPC, CBP track revenue cycle operations, clean claims, and denial focus. When we're looking at the interview opening, a lot of candidates get nervous by, or they don't really know how to answer the question, tell me about yourself. So we decided to put this in the webinar today. So I completed structured training through AAPC that integrates both coding and billing competencies. The program covered ICD-10, CPT, HCPCS, full claim lifecycle workflows, denial categories, compliance requirements. I've applied these skills through case-based study practice, and I'm prepared to contribute to clean claim production under supervision while building applied experience. So, we've gone over kind of the positioning, but why does it work? So hiring managers don't care about the brand name of your training program. They care about reduced onboarding risk. So when you describe your training in terms of competency frameworks, workflow understanding, and applied practice, you're communicating that operational readiness rather than just academic completion. So this positions the AMBCI as professional preparation rather than generic education. All right, so we've created some example templates here. So these are, 3 different templates that are suitable for the applicant tracking systems, hiring manager preferences, and revenue cycles. And each kind of supports a different career entry strategy. So for an entry-level coder, you want to have your summary, your core skills, training in applied projects, and your certification track. If you're focusing more on the entry-level biller, you have your summary, your core skills, applied projects, and certification track, very similar. But if you're looking into dual revenue cycle generalist, again, the same outline, but the language is a little bit different. So summary, core skills, applied projects, and certification track. Um, this is this template is ideal for small practices, specialty clinics, and remote RCM vendors who need staff capable of handling multiple revenue cycle functions rather than highly specialized coder or biller role. But again, in the upcoming months, we'll go more into resumes, templates, um, and how to present yourself to employers from a resume aspect. So, cover letter templates. So, not all employers require cover letters. If you're entry level, if you're a career changer, I definitely recommend having a cover letter. It really allows you to, showcase um, who you are, what you're looking for, what your experience is, what your knowledge is. So we've given two examples for one for a coder track, one for billing in denials track. Um, Essentially, the same kind of format. So, dear hiring manager, I'm applying because my experience is I've completed, you know, uh, the cases, the competency through da 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 da. I'm available for an interview, da 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 da. You attach your resume, your name, your phone, your email. If you have a portfolio, your LinkedIn page is also a good one to put on there. But a cover letter strategy that works is keep the total word count in your cover letter to 250 words. Hiring managers typically take about 15 to 20 seconds for a cover letter. They take about 6 to 10 seconds to look over a resume. So you really want to put your best foot forward, lead with competency alignment, demonstrate operational awareness, and then close with availability, deliverables. Um, don't ever apologize for being entry level. We all start out some way in our careers at entry level. You just want to make sure that you are really positioning yourself as prepared and ready for work. All right. So I talked a little bit about effective LinkedIn profiles. So it's your passive recruiting tool. Recruiters are on LinkedIn like nobody's business. When they have a job opening, typing in keywords, searching profiles, reviewing them. They also filter by those keywords, credentials. So again, we talked a little bit about the headline options. This is the first thing that pops up with your name. And in the search results, if a recruiter is going into LinkedIn, typing in, I don't know, CPC or CPB, it's your name and that headline that pop up first. So you really want to make that, high level focused, who you are, what your knowledge is. Within your profile, you have an about section. So this really focuses on your knowledge, your experience, your credentials, what type of role that you're seeking. There's also a featured section that you can use as a strategy to showcase your deliverables that really do prove your competency. So your AMBCI certificate, you can upload as a PDF. You can have a one-page clean claim checklist. So you can go into Canva, create a free PDF checklist showing your workflow knowledge or Word, denial track template, Practicode performance profile. If you're unable to download and kind of make that a PDF, you can do a screenshot or a summary showing the case volume and the accuracy. This is those are some really great strategies to make you stand out against the rest of the candidates. So definitely think about and do that. Also, the skills section. So you can have up to 50 skills on your LinkedIn profile. You do want to list those in priority. So LinkedIn does show the top three. Um, so position those skills strategically against the positions that you're looking for. And then kind of your activity strategy, you want to post or share content to increase your profile visibility. You can share articles from the AAPC. You can post about your certification exam milestones. You can share revenue cycle insights, engage with posts from coding managers and leaders in your target geography. So, one connection strategy that I do recommend, because a lot of positions nowadays are about referrals, about who you know, that LinkedIn piece, you really want to put yourself out there as much as you can. So follow individuals that are within revenue cycle, kind of that leadership. Coding supervisors, local clinic administrators, connect with coding managers, billing supervisors, recruiters. You want to be personalized with your outreach. So it can be something very short and simple like, "Hi, Bob, I'm completing my CPC preparation and I follow whatever company this individual works at in revenue cycle operations. I'd appreciate connecting to learn from your insights." Um, if you get connection requests from recruiters, accept those. Beware, though, there are a lot of scams going around. So you can look at the individual's about profile, see how long they've been on LinkedIn, see how many connections they have. There are definitely some, red flags that will decrease the potential for a scam. But you really do want to focus on those connections being operational leaders who are actively hiring. All right. So internship creation and outreach strategy. So most clinics don't post internships. So you must create a low risk pilot that solves a real operational problem. So let's talk about what that looks like. So where internships actually happen. So target the types of environments because they do have that billing pain, limited staff, lower risk tolerance for expensive mistakes. So those environments are small private practices, DME suppliers, urgent care networks, specialty clinics, behavioral health billing offices, PT, and chiropractor groups. So when you reach out and you kind of offer yourself as, someone who should come in as an intern, that you're going to come in and solve a problem, you don't want to ask, "Can I shadow?" or "Do you have an internship program?" Instead, what you want to do is position and offer specific task completion that reduces existing backlogs. So, um, some of the tasks that you can offer safely are eligibility verification, checklisting, denial categorization, and tracker building, claim status follow-up calls and documentation, appeal draft preparation, payment posting, reconciliation support, chart documentation, completeness checks listing, and organizing charge tickets and encounter forms. So if you're looking at this from a LinkedIn outreach, you want to send the connection request, message after, the individual accepts your connection request. Within after 6 days, follow up, and then follow up after 12 days. This timeline shows that, you're interested, you're ready, um, you want to solve a problem. Um, so it also doesn't kind of put you out there as, oh, what's the word I'm looking for? Overly eager, or annoying. I've seen some individuals like follow up day after day after day. Hiring managers, employers, clinics, they don't want that. Um, we've also added in here some cold email templates for clinics, phone scripts. But again, we're going to go into a deep dive with this type of information at a later date. Um, and then, looking at how do you convert paid in an internship into a paid offer. So, if the clinic says yes and they bring you on for this pilot, you want to remember to send weekly email every Friday documenting measurable output. So, number of claims followed up, denials categorized and corrected, appeals drafted, eligibility issues caught before submission, recommendations to reduce repeat denials for the next week. So clinics hire the person who already acts like a reliable employee. So if you're documenting results, you demonstrate initiative, you reduce the workload for the billing manager. The conversion in the story for you kind of shifts from can we afford to hire versus can we afford to lose this person? All right. Billing and coding interviews prioritize accuracy, discipline, compliance awareness, and workflow reliability over enthusiasm and personality. So, your answers to these questions must demonstrate operational readiness and risk mitigation. So, we're getting close to the hour. So, I just kind of want to highlight some questions um, for billing and coding. So, why billing and coding? Tell me about why you chose billing and coding. How do you handle uncertainty? How do you reduce denials? What would you do in your first 30 days? So, for this one, I do want to point out you want to put kind of like an action plan together. So, what's the goal for the first 30 days? And then you can break it down backwards into smaller, actionable tasks that you can present to the hiring manager. How do you manage high volume workflows? How do you handle feedback or corrections? So these are some really great questions to kind of take note of, prep yourself for. You can even go out on Glassdoor, Indeed. You can see some individuals post interview questions that they've been asked for that specific position. You can also work with ChatGPT or Gemini and say, what are the top 10 billing and coding questions? Um, and the platform can essentially kind of help you prepare and how to respond when asked that question, just to really ensure that you're prepared for that interview. All right. 30, 60, 90-day planning. So, bring a written 30, 60, 90-day plan to interviews. Again, you can start with the goal for 30 days, the goal for 60, the goal for 90, and then break it backwards into smaller actionable tasks. This demonstrates you understand performance expectations, progression timelines. So hiring managers hire candidates who think like employees. So when we're looking at the first 30 days, you're going to build your foundation and accuracy baseline. So making sure you have your primary objectives and success metrics for each part. So for the 30, for the 60, and the 90. For the first 60 days, throughput and process improvement, and then independence and leadership contribution. So when you're interviewing, you want to position this plan by saying, I prepared a 30, 60, 90-day plan that outlines how I would approach onboarding and performance progression in this role. Would it be helpful to walk through it? And then you can hand them this printed one-page summary. And again, this really does position you as someone who thinks strategically about performance rather than just hoping to do well. All right, so placement strategies. Again, we're going to do a deep dive in this, but it's placement is not passive. It's a structured campaign with daily execution discipline. So we've listed out some tactics to represent a comprehensive job search system effective for billing and coding roles. So targeting and search strategy. We talked about the different types of titles. So you want to be sure that you're out there applying to not only billing and coding specialist, ATS and resume mechanics. So keywords, keywords, keywords. If you have any previous experience, transferable skills is a big one also. LinkedIn conversation, high level, your headline, your profile picture, your about section, your skills, making those connections, outreach and referrals, making sure you're reaching out to individuals in the industry. So recruiters, groups, employers, hiring managers, you want to make sure that they're targeted, they're personalized, and then internship creation and conversion. So offer that pilot we talked about, call clinics during non-peak hours, practice those interview questions, those behavioral questions, bring your 30, 60, 90-day plan. All right. So the last piece we're going to go over is the critical compliance note. So never imply you can code independently without supervision if you are not credentialed or not in a role that allows independent coding. This is not just a best practice, it's a compliance boundary that protects you and the potential employers. So coding without appropriate credentials or supervision creates audit risk, compliance exposure, and potential fraud liability. So, when you're positioning yourself in the interview, you don't want to say, I can code independently right away. Or I don't need supervision. I already know how to code. Or I can handle a full core caseload without oversight. I'll figure it out as I go. Do not say those things. Instead, what you want to focus on saying is, I'm prepared to code under supervision while building applied experience. I understand I'll need supervisory review until I demonstrate consistent accuracy and remote apprentice status. I'm trained in coding fundamentals and I'm seeking a role with structured oversight and quality assurance processes. I document uncertainties and escalate coding questions to ensure accuracy rather than guessing. So why does this matter? How you say things? Because hiring managers value honesty and controlled escalation. And it's because of audit defensibility, compliance risk, trust and reliability, and training investment protection. The right mindset is positioning yourself as a supervised ready rather than fully independent. Does not make you less hireable. It makes you more hireable because employers do expect entry-level coders to need that supervision. What they don't expect is self-awareness, documentation discipline, and willingness to escalate uncertainties, because this in combination is rare and valuable. So your goal is not to convince employers you don't need training. Your goal is to convince them that you'll require less correction, you'll learn faster, and transition to independence sooner than other entry-level candidates because you understand the importance of accuracy, compliance, and controlled escalation from day one. All right, everyone, we are at the hour. Thank you so much. I hope you enjoyed. I hope this was helpful. Again, the recording will be uploaded into your Thinkific program. I'm hoping to get it done by the end of tomorrow. Definitely reach out if you have any questions. But again, I know this was a high level interview overview. It was a lot of information, but we're going to be going through it more individually in the months to come. Thank you all again so much. Have a wonderful Friday Eve and stay safe.